So what happens when you get older, or when you get dementia, or when you get Parkinson's, or when you get depression, or you get PTSD? Decreased sleep. Traumatic brain injury, the most common thing we see is disrupted sleep.
It's huge.
So those toxins start to accumulate. Now, a study just came out here a few years back that 1263 nanometer light enhances the clearance of toxins through the lymphatic system. This is a mouse study. These are genetically engineered mice that produce excessive amyloid.
Hey guys, and welcome back. Dr. Sinicropi here. We are having a great time at the Society for Brain Mapping annual tech conference. I'm so happy to be joined by Dr. Theodore Henderson, who is an absolute pioneer in the world of light and laser therapies. And he just finished giving a master class on treating concussions and other brain conditions utilizing transcranial laser therapy. And the images that you showed of the SPECT scans before and after were so powerful that people in that room that had never heard of light or laser therapy, because I get that all the time when I try to talk about this stuff, were really interested. I mean, some of the people that were asking questions, they've never seen this stuff before, but the data that you are presenting is so powerful that it's making them say, wait a minute, have I completely missed the ball on this? Because obviously there's a lot of neuro people here, so you really piqued their interest.
So it really goes back to my work in neuroimaging. I was medical director of a SPECT brain imaging center in Denver, and I was approached by a colleague, a chiropractor, who said, hey, look, I want to see if this infrared light is helping these patients with traumatic brain injury. So I want to do a SPECT scan before, treat them, and do a SPECT scan after. And my initial reaction is, you want to do what? I mean, infrared light? It's not going to get through the skull. What are you talking about? And so my colleague is Dr. Larry Maurice, who's since passed away, but he became my partner in all of this, and we established the foundation and the company together. But it was really Jenny Faraday, who was a social worker in the center, who said, Doc, trust me here, read the literature. You brought a stack of papers. It's all from Harvard. And that was it. I mean, when I started to see what the folks at Harvard had shown in animal models, in particular, the activation of BDNF. As it happens, my postdoctoral research, I'm both an MD and a PhD. So I did my PhD work, and then I was a postdoc while I was a resident. And the first two grants I had were looking specifically at BDNF and other growth factors in sculpting the brain during development. So I understood BDNF at this very deep level, and I knew how powerful it was as a reshaper and an activator of neuroplasticity in the developed brain. So that's what got me excited, was that piece of knowing that we could turn on neuroplasticity. And then, I said, before we can do all that, we got to figure out how to do this right. And so that's when we went into the research lab and did tissue study.
Yeah, and I think, your work is really fascinating. The favorite part of your description right now is when you did this thing. Because this is what I do with my colleagues. So one of the things I was saying upstairs is that once you see the light, so to speak, once you are, whatever specialty you're in, as a physician or you're a scientist or whatever, once you dive into the actual research behind it and start reading it and then see it actually happening in patients, we become like these evangelists. We can't. We just want to tell everybody and everything. And I think that's the best way to do it. Instead of say, hey, here's a stack of papers. That's how they finally got me. Because somebody got me. It took me 6 months, as I was telling you before even considering light therapy, because I just thought it was some gimmick, some weird. And I was like, you're going to shine a light, and what's it going to do? But then when you look at the science, I kind of felt a little bit. I don't know. It's like, what is wrong? Why I need to open my mind more, and it just turned into this huge, epiphany, and all of a sudden we're seeing all these patients. So this motion, it's like when people start like pushing back or say, just look at the stuff, because it's so powerful. So for people that are watching this, a lot of them are not going to know, because as you know, even though some of the audience that's going to see this, they're hardcore scientists, they're doctors, they're whatever, they hear us talking about light, they shut the channel off, because they just don't. But so as far as defining things, so photobiomodulation, right? Light, using light to modulate biology, so to speak, but you've got to get the light at the right wavelength, at the right frequency to stimulate, the production of ATP through the mitochondrial thing. We don't have to go into all the science, but one of the things you've really pioneered is this concept of you've got to get the light to the spot, and so penetrating the skull. So can you kind of talk in lay terms about the differences between LED and how that works, and a more powerful laser like a class 3 or class 4 like we use? I mean, class 4 is the most powerful. That's the one that really can penetrate. Can you talk about your work and kind of your feelings on that? And I know there's some debate in the photobiomodulation world. We're not going to get into all that, but certainly, can you talk about the differences between the two?
Sure. So the first thing is to understand that to have a biological effect on a cell, you had to deliver enough energy to that cell, 0.5 to 15 joules per centimeter squared. That amount of energy has to reach the cell. If the cell is, in the middle of the brain, you've got to get through centimeters of brain, and you got to get through the scalp and the skull. So you had to start with a whole lot more energy, because the scalp absorbs about 60% of the energy. The skull absorbs about 40% of the energy. If you have hair, you're lucky.
I'm the perfect person to have the
hair blocks 98% of the energy.
Yeah.
So in treating our patients, we have to be able to deliver energy of sufficient power at the skin surface that it gets through all those layers with enough energy to activate the cell. So that's the big picture. Now the LEDs are 1/2 watt. 1/2 watt of infrared light penetrates 0.8 millimeters through human skin. In other words, it doesn't get through the skin. And we've shown that, and a number of other researchers have shown that. So it's well replicated, solid data. What these LEDs are doing, though, is they are getting to the skin. And so there are a number of LED studies, 4 studies now on autism, several studies on mild cognitive impairment, 6 studies on traumatic brain injury, showing that an LED device does something clinically. People get clinically a little better.
Yes.
Not a lot better, a little better. And why does that happen? And that's the difference between direct photobiomodulation, which is what we're doing with the class 4 laser, where we are getting through scalp and skull and into the brain and reaching that cell with enough power. And indirect photobiomodulation, which is where you treat the skin. The skin releases a protein, presumably a factor, that travels to the whole body. Now, indirect photobiomodulation has been shown in a number of different models. Just really quickly, take a bunch of rabbits, give them a wound on each hand, each foot. Treat one wound with infrared light. Have a bunch of rabbits that you don't treat at all, have the same wound. Look at how fast they heal. The wound that got treated with infrared light heals faster. What's interesting is the wound on the other hand that did not get treated heals faster too. So that's a simple example of indirect photobiomodulation. Now, one of the ways that we've been trying to get the field to realize the importance of that distinction is that there are people making claims about these low-power devices healing traumatic brain injury, improving Parkinson's disease, et cetera, et cetera, et cetera. And those claims are true a little bit, but their claims are exaggerated. And the danger is that the field could become, we could become called shysters and charlatans. And,
100%.
and that danger is there. I saw that happen in SPECT. SPECT is a wonderful modality. It's been completely trashed in the medical community because exaggerated claims, making claims before there was data. One of the reasons I went to that gentleman the very first time and said, you might be right, but you cannot prove it. You need to do the science, which is why we collaborated. So science is, for me, science is the bread and butter and the base and the foundation upon which everything has to be pushed through. Everything has to be proven for me to believe it. Now, just one other thing I'll give you on indirect photobiomodulation.
This is great.
This is a very cool study. So again, this is a study we did on ourselves. So I got my staff together and we all agreed to participate in this study. So as you're aware, 1064 nanometer light has a cognitive enhancing ability. Gonzalez Lima has shown this in both college students and in folks with mild cognitive impairment. And he's also shown that it increases cytochrome oxidase, which is, in other words, the mitochondria working better in the brain.
You're producing more ATP.
And he's shown that blood flow improves, and on EEG, he's shown that alpha wave activity goes up. So the the frontal lobe is thinking better. So we did a study where we shown infrared light, 1064 nanometer light, on our forearm while measuring QEEG. So we had a QEEG alpha wave power at rest, and then while treating with infrared light, alpha wave activity goes up. Then you have a rest period, it goes back down. You shine infrared light on the forearm, alpha wave activity goes up. Now here's the
I have not heard that. That's very interesting.
So indirect photobiomodulation, clear proof of that. Now, I did one other study. I only did it on myself because it's painful. I cuffed my arm and ran it up to the point where I had no pulse.
Yeah.
So no blood in, no blood out. And we applied infrared light to the forearm. Nothing happened. The alpha wave activity did not go up. When I released the cuff, the alpha wave in my brain went up.
Is it through blood flow, or is there something happening through the skin?
That is what I think I'm proving. I think I'm proving that it's blood.
Yeah, that's exactly what I said. That's got to be. It's interesting everything you're saying on the indirect photobiomodulation, because as you know, I had, and I love that you called him the Godfather. He really is, and I always say that. And I spent about 3 hours talking to him. Not everything we put on the podcast, because we were just debating all kinds of. I'm not going to debate with the guru, but we were talking about the high power, the indirect versus the direct, or high power versus low power, and so I just kept pushing him. I was like, because this is what we see clinically. Yes, when we're looking at patients that are having just indirect photobiomodulation in a bed. Right, and we have these pretty powerful beds we put people on. Yeah, they get better, but they're not having these profound, they're different. Or if you put on there, because you're still getting it on the head, it's not like that much different than putting the cap on a little bit closer. But then when you're doing the transcranial laser, even in normal people, like I did it to my part, like I have this world-renowned neurosurgical partner, Dr. Nussbaum. Right? His textbooks are published in like every language. After he comes out, you get that kind of euphoria. So he's like, I feel really, really good. I feel great. And you get that a lot. And obviously the people that are impaired, it's stimulatory, they just feel better. Is a big difference between putting somebody or put a helmet on or having them go on the bed as far as how their cognition improves versus directly shining the light on the brain through the laser. I see, it's one of those, I don't need a study. I just do it, right? I say, okay, try this. Oh, I don't feel anything. Try this. Oh my God! Like everything's clear. I can see everything. And again, I'm not even over the top. You see this all the time. There is a euphoria. Dr. Hamlin said he gets like a little bit of a mild euphoria, and I was like, well, you should try the laser. If you like the feeling of this increased cognition, try the laser therapy. So, we were getting into it with that, and he's like, well, it works. No matter what, as far as let me ask you a question though. The reason it's a really interesting debate when it comes to, right, synaptogenesis, is there a mechanism where the indirect light can also create that? Because I know that the light, the laser light can do that. What do you think? Is there a messenger that is also helping those factors to increase, even if you do it only indirectly?
That is my belief, that indirect photobiomodulation is turning on some skin-derived protein, substance, factor. I mean, somebody's argued that, it could be electromagnetic through the fascia, and it's like, I don't think so. But just practically thinking, it's probably a protein of some sort that gets turned on. And it clearly has wound repair properties. There have been several
huge. NASA, right? NASA showed that their astronauts in the presence of red light were healing their wounds very rapidly.
Yes, yeah. But the work of Johnstone and his colleagues down in Australia, they did a very interesting study where they put an aluminum helmet over a mouse and shined infrared light on its back. So this is indirect. It's not treating the brain, they're treating the back. And then they injected the mouse with MPTP. MPTP is a toxin that kills the neurons the dopamine neurons that are responsible for what leads to Parkinson's.
Yes.
The loss of those neurons. And so MPTP is a chemically induced Parkinson's disease. Well, what happened was the mice that they treated with this indirect photobiomodulation had much fewer cells die.
So neuroprotective, significant
neuroprotective
neuroprotective effect.
Yes. And so, that argues, and I've seen this with my patients, maybe you've seen this with your athletes that, they get a concussion, you treat them, they go back out on the field, they have another concussive event. Well, what I'm finding is my patients are having concussive events, but not concussing.
Because they're protect. I mean, it's
neuroprotection.
I do a lot of light therapy on my own. Obviously, I know what it does, so we're going to do it. And those of us that do it, they do it. I mean, Hamlin sits there with the helmet on, all the time, and he's like, I'm protecting my, we got into it. But yeah, the neuroprotection is huge, which brings on to, now we're talking about treating, and we talked about like these amazing stories of people that are concussed like you had that one person 32 years later and they're improving. We're seeing that all the time.
Yeah.
It's just, you don't need some, people are like, well, where's the studies of 1,000 people? I was like, well, who's going to pay for that?
Yeah.
Who's paying for this? The NIH is not paying for it, because as you know, you work with the guys at Harvard. I had them on my podcast. Dr. Casano's like, yeah, we submit these things and we have so much data behind our stuff, and they're not getting the grants, approved. Now I know you guys are waiting to hear maybe on this other grant, but just switching. So for early dementia, for Parkinson's, there's things going. There's all kinds of things. But interestingly, in Dr. Hamlin's book, and I remember I was on a plane. I have his book. I have it like outlined, that photobiomodulation of the brain. I just love that book. It's awesome because he has all these other researchers talking. But there's that one chapter that talks about pretty much doing photobiomodulation in normal, healthy individuals as we get older. And kind of and they're just throwing stuff out there. Again, it's not this is not medical advice or anything, but they're just talking about once you get to a certain age, just to protect your brain from losing your cognitive abilities, especially treating the frontal lobe. Everybody should be getting treatments with light therapy to their brain. I certainly do. I mean, we all do it. All the people around me, we all do it. What's your thought on that? Hamlin's like, absolutely, you got to shine. He's like, shine the light on the brain. There's no reason not to. He wasn't super confident in because that's not kind of his area. He's more like with the disorders. But what's your idea? Don't you think everybody should have some level of photobiomodulation for neuroprotection?
I would fully agree with that, and I'll add something to it. One of the recent pieces of data that came out was the understanding of the glymphatic system. So
Yes.
we just now discovered the glymphatic system. The glymphatic system, as you know,
Yeah.
is a lymphatic drainage system within the brain, and it's runs right along the outside of the small capillaries and the arteries and the veins, and interacts. So it's clearing stuff into the bloodstream. Now, that system works best when we're in stage 4 sleep. And it doesn't work very much at all when you're fully awake. So what happens when you get older, or when you get dementia, or when you get Parkinson's, or when you get depression, or you get PTSD? Decreased sleep. Traumatic brain injury, the most common thing we see is disrupted sleep.
It's huge.
So
Yep.
those toxins start to accumulate. Now, a study just came out here a few years back that 1263 nanometer light enhances the clearance of toxins through the glymphatic system. This is a mouse study. These are genetically engineered mice that produce excessive amyloid. Amyloid's the toxin in Alzheimer's, as you know.
It's my first thing. That was actually, I wrote a paper on neurofibrillary tangles and all that stuff. That was my first, that's what I did before I went to med school. That was, I was in the lab at Albert Einstein in the Bronx. So yeah, this it's just fascinating stuff. Sorry to.
No, it's funny how our lives sort of,
And then I went into
themselves.
ortho, and then and ortho spine, and now I'm all the way back to the brain is just. I've always been fascinated by the brain and concussion and all these things because it's just such a. I don't want to call it a black box, Pandora's box, whatever. It's a box. Go ahead.
So with the 1263 nanometer light applied to mice with excessive amyloid, the mice that were treated had 4 times less amyloid in their brains.
This is incredible.
Just a huge clearance. So, the advantage of that for, just as you age and, if we, have a beer or 5 at the game, or, a bottle of wine or 2 over dinner, we got toxins to clear out. And that's, I think, one of the underappreciated aspects of photobiomodulation.
No, absolutely, the toxin clearance. But not only that, just going down just getting very much into integrative health and things like that. So now, just learning about the way that dementias develop. And so I was at a lecture yesterday, and again, just talking about how toxin exposures are so connected with development of these brain. Obviously, there's a genetic component. There's other components, and we always talk about what genes are activated, what's not. But there's a toxin, and we are so exposed to toxins in our environment. Not to microplastics and 5G. We could go on and on. There's all different types of toxins. But you're right. If you're not clearing the things, and so again, photobiomodulation is so powerful. Let's get a little bit more broad. In the bit of time we have left, why is it so hard? Why is it so hard to get this concept of photobiomodulation very widely accepted in the mainstream? I've been practicing for 20 years, spine surgery, right? Outside of this thing, got into this for 2 years. It is as crystal clear, there's nothing more crystal clear to me that photobiomodulation should be widely accepted, no question about it, throughout all of medicine. I'm giving a TED talk at Harvard coming up here in April on that exact topic. Why is it so hard to penetrate the thing? I give lectures, not to big audiences, like you've been doing this a lot longer. Have 100 people in the room. How many people have ever heard? And these are like providers. This isn't the lay public. I'm not, at some, whatever, some little function. So these are all docs. One person will raise their hand. Ever heard of it?
Yeah.
Why is it such a struggle for this not to become front and center? And I'm talking about, right, people that are undergoing chemotherapy, people that have autoimmune disorders, people that have cognitive decline. All these people there is benefit. There's thousands of articles on this stuff. Why is it so hard? I'm going to ask somebody that has dedicated so much of his life to this stuff and is so well published. What's the problem?
So part of it is that people, you say light and they think light, like, oh yeah, fluorescent light, or a light bulb. I have people call me up and saying, oh, well, I got this incandescent bulb and it puts out 300 watts of infrared light. Okay, that's useless because it's non-coherent. And so people lump they lump light into one big word.
Yes.
I mean, it's all one thing to them. And so understanding that infrared light is different, that's a real struggle for people. I liken a bit to the stem cell model. So stem cell therapy, 15 years ago, if you said stem cell to somebody, they'd say, what, you want to stick daffodil stems in my body? What are you talking about? Get away. And now you ask anybody, they know what a stem cell is. So it's that education of the general public. And in many ways, understand, a lot of doctors, they don't read. They do not read the science. They're not keeping up.
Or they read, but they read here.
Little tiny cylinder.
Read here. The net right now, the stuff that's out here, it's unbelievable. It can change patients' lives, and it's pretty easy. But keep going.
But again, most docs, if they did not hear about it in medical school, they don't believe it.
They just don't. They don't. It looks both of us. Right, we had to get we got pulled into this thing. I wish I had when the year you got pulled in. I wish I was pulled in that year. It would have just changed. It just changes everything.
Yeah.
Do you think you mentioned the light thing, and this is something I think. Do you think that that our not just the medical community, but also just kind of the lay public, it's like we have been so brainwashed to think that everything has to be complicated. You think that's one of the big factors on why people can't? They're like, "What's light going to do? What pill are you giving me?
Right.
What procedure?
Okay.
Oh, you want to I'd rather they'd rather have a hole drilled in their head and some crazy fancy thing, or have their CSF drained, and then they say, "Oh yeah, I'll sign up for that," and they say, "Oh no, we're going to just put light on your head." They're like, "I don't want to do that. It doesn't do anything."
Right.
Because
exactly.
Right, it's too simple.
Now there is an interesting. Things are changing. So there is a growing recognition of red light therapy.
Yes.
And so there's TikTok videos out there, and people are selling stuff, and Amazon has a dozen, again, useless devices you can buy. So it's just starting to turn the corner. And I think that will, start to get the ball rolling. Just as what happened with stem cell therapy, it takes time for a new concept to sort of filter down. Now, but what we really need is huge marketing. We need huge sort of patient education going on out there. And if the patients are bringing it into their doctor saying, hey, there's this new pill that will help stop my tremor versus, hey, there's this new light therapy that would help stop my
Correct.
tremor. I mean, that's where I think things start to change.
Except the one thing that I see is that people go back. So I've given this example before on social. I know where you're going. I'm just bothered. But so we have this, for example, there's one patient. I can give you 100 patient examples. One patient who had significant, multiple chronic diseases, miserable. Kind of felt trapped in their own bodies. Was able to walk, was able to work, but miserable, right? Would have to go to sleep right after going to work. They were completely, so anyway, put them through the program, did a lot of light therapy. They had we did the cognitive treatment, laser therapy to the head, whole body light therapy. We combined a lot of different stuff. Went back to their primary after a couple months, never felt better in their life. Went skipping in there, and so at the end, the primary's like, wow, you're doing really good. What are you doing? Say, well, I'm doing all these, light and laser treatments. Response from the primary, enjoy your placebo. Mm-hmm. Literal words. She fired that doctor. She's like, I'm never going back there again. Mm-hmm. That's the opposite of what I needed to hear. And so I know you see this stuff all the time. So that's my frustration has been this loop of people doing well. They do go back to people, and then they're not believed. Mm-hmm. Mm-hmm. Like I had another lady that has a adult degenerative scoliosis, horrible back, was treated with laser therapy, had almost complete relief of her pain, okay? And she became she just telling everyone. She came back just to tell me, she made a visit in my spine surgery clinic to tell me she's been telling everyone and how frustrated she is that her friends and family and her dentist, because that was the story, that the dentist really pissed her off, doesn't believe. They're like, oh no, your pain just went away on its own. She's like, well, I've had pain for 9 years. Mm-hmm. It just doesn't go away, and just wanted to voice their frustration. I was like, you're talking to the right guy, because you see this stuff, it's so powerful and it's frustrating. So, we could go, we could do this for quite a long time, but I just want to thank you for all the work that you've done. If people haven't seen your work, they should really, look you up, Dr. Theodore Henderson, really at the forefront of what's going on out here in laser therapy, and I look forward to collaborating with you and doing a lot more, because the things that you're doing in some of these veterans, in NFL players and things like that. Do you want to talk as we finish up on these NFL players that you're seeing? And obviously you take care of a lot of concussions. Mm-hmm. Your results are so dramatic in improving their anxiety levels, their sleep patterns, even suicidal ideation, all these other things. Do you want to talk a little bit about how profound your before and afters are, which you showed in your lecture today?
Yeah, and across the board, regardless of what the person's profession is,
right? It doesn't matter.
Veteran or not a veteran, whatever. We're saying across the board, great improvement in sleep, in cognitive function, in memory function. Headaches go away for most of the patients. Photosensitivity, they can't tolerate bright lights. That gets so much better. And the patients that we're able to do SPECT scans, that we have the functional brain scan on, we're able to see a before and after image, and the neurophysiology is there. It's
there.
Very clear. It's a dramatic improvement. Often, the area of malfunction in the brain decreases 70-80%. And the severity of any of the leftover areas of injury are much less than what they were originally. We do a comparison statistically to a normal database, so I can say, okay, that area is 5 standard deviations below the mean of the normal database, and after treatment it pops up to 1 or 2 standard deviations.
Incredible. Yeah, so again, and I started off with that. If you presented this, for example, this is how I want to end this. If you presented in a room of 100 neurologists, and let's say neurologists and neurosurgeons and ortho guys that treat concussion, if you showed the data that you just showed in the lecture this morning, I don't know how every single one of them doesn't walk out of there and say, I'm going to investigate this for my practice. Because again, you're not saying, hey, put all your patients on this medication that might have 7 horrible side effects. I'm not saying they're all going to get it. And again, I'm a big proponent of medications. They save millions of lives, right? We all know that. You use medication in your practice. We all use medication in our practice. The thing that just bugs me is that you would present that, and even with that data, some people are just like, well, I'm not.
They would say, show me the double-blind, placebo-controlled clinical trial.
Exactly, but I will tell you, and I think the most powerful thing is when you're doing it in clinical practice, when you see one, you say, oh, this is interesting, and then you see 2, and then you're on your 10th patient, and people are having these profound results. I understand that, but I understand that people want these double-blind trials, but there is something called common sense.
Yes.
And when you're doing it with the risk factors, as shown in some of these studies, like by putting light on the brain, it's such a safe. It's one of the safest things that you can do, right? There's certain indications. Again, this isn't. I always say when we start getting into the weeds, not medical advice. But yeah, I think that your research needs to be shown to every single neurologist in the country, anybody that's taking care of concussion or Parkinson's or whatever. And really, I hope I can help you to get your message out. So, Hopefully
All
we
right.
did that today. So
Okay.
thanks for joining us.
Appreciate
This was incredible.
Yeah.
I got about 50 more questions for you, but we're limited by time.
Next time.
Thanks a lot. Thanks for being here, and we'll see you. We'll see everybody next time.